Good afternoon, everybody. I hope you had a great weekend, especially Saturday. Warm weather and another UConn women's win in basketball. That was a good day. I'm here joined with Paul and Josh and Beth Bai and Vanessa Durantes. We're going to talk about kids in a minute. As you probably remember, the Vice President Kamala Harris was here on Friday, along with our former commissioner, Miguel Cardona, now is Secretary of Education. Miguel always says you can tell a lot about a society by how often they ask, how are the kids doing? We're going to talk about that a little bit today. But first, the COVID summary. Remember, these are 3-day numbers. What do you see on that? It says, one, we are still doing a lot of testing, 91,000 tests over the last 3 days. So we have a fair number of cases, too. Don't get confused by numbers you see around the rest of the state. In other parts of the country, especially down south, they're doing, 20% as much testing as we are. So their number of cases per 100,000 look a lot lower than they are just because of the testing differential. The positivity rate, 3.5%, pretty much that's the 7-day average. Pretty much that's the 14-day average. It is plateaued, though. Hospitalizations is creeping up. 42 is the 3-day number, but 498 current hospitalizations. Josh tells me that's probably the most in a month. Tons of capacity, nothing to worry about there, but it is something we continue to watch. Fatalities, that's about 6 a day. Overall, if you look around the country, the number of people testing positive, the positivity rate is up a little bit. You've probably heard some comments from the CDC and the such. We are watching that very carefully. The vaccine update. I think this is good news. You'll see that 61% of the people 55 to 64, 38% of the people 45 to 54, almost 2/3 of the people 45 and above have now been vaccinated with their first shot. We trail New Mexico, but we're doing pretty well on that front. I thank you for everybody making the effort there. Our federally qualified health centers, our pharmacies, obviously our hospitals making the effort, and each and every one of you putting up sometimes a little bit of frustration when it comes to getting that appointment, but you're getting the appointment, you're getting the shots. And as of today, there are some spaces available as we get towards the latter half of the 45 to 54-year-old group. Here's your chance, team. Go get it. We're going to have 240,000 appointments available this week. So here's your opportunity, and I think it's an opportunity you don't want to miss. I just as an aside, I often like to look around the world, see what we can learn from what's going on, and it is a tale of two cities. Those countries where people are taking the vaccination seriously and making a difference, and those that are not. Look at Britain compared to the rest of Europe. Britain, a high proportion of people vaccinated. They're rolling that out aggressively, continuing to cautiously reopen. What a contrast to, say, France and Italy, where they're closing down. They're running short on vaccines and a much lower percentage of people vaccinated. Israel is probably the success story around the world. Well over 50% of the people vaccinated there, opening up comfortably, confidently, and cautiously. Contrast that with Brazil, where they did not take it seriously, where they do not have the vaccines, and I'm afraid that P1 variant, very dangerous, is spreading dramatically there. Connecticut, and I'd say broadly the United States, is much closer to Britain and Israel on this front, but it does remind you it's a race, and we got to stay ahead of these variants. Going forward, first in the nation FEMA mobile vaccination unit. This is worth memory. We were down at Bridgeport today. This is the very first mobile vaccination unit that FEMA has provided around the country. There'll be others over the coming days. It's going to spend 10 days in Bridgeport, then go elsewhere. Right now they're doing the Johnson & Johnson vaccine. And I was really proud to see the number of people lining up. They had an appointment, but they got there early because they wanted to get there early. And it just shows that we are going to make an extra effort, especially in those communities where people aren't necessarily shy about getting vaccinated, but it's not easy for them to get vaccinated. We're making it easy for them to get vaccinated. It was remarkable. I mean, it's just full refrigeration, lots of standby power, so you can keep the J&J cooled, you can keep the Pfizer cooled, and that's going to be spend 2 months in the state of Connecticut. That's the first activation of FEMA's mobile vaccination van. Next up, Max. As we move forward towards April 1 and to open up to everybody, 16 and above, everybody that FDA has approved to get vaccinated, we want to make a special effort to talk about those who are medically most at risk. You maybe remember going back a couple of months, the CDC had a list. It was a very big list. It included probably over 1 million people in the state of Connecticut. It included mild obesity and smoking. And it was nothing that we thought we could deal with as a separate category. We dealt with those folks by getting 2/3 of the people 45 and above vaccinated. That's where the bulk of those folks who are in medically fragile condition we were able to handle. But we're going to have a concerted effort starting on Thursday, which is April 1st. Josh has met with all the chief medical officers of all of our hospitals saying, how would you prioritize the riskiest conditions? And I want you to reach out. We can provide you additional vaccines as needed so you can take care of these people on a very timely basis. That's sickle cell, end-stage renal disease, active cancer patients, solid organ transplants, and Down syndrome. Those are the key categories that our hospitals are reaching out right now to make sure that you're close to the front of the line as we make this available to all age groups on Thursday. Also, talking about the kids and how are the kids doing, all patients at Connecticut Children's and Yale New Haven Children's Hospital getting the vaccines, reaching out, all of them are going to be vaccinated over the next couple of weeks. So really prioritizing the kids and those folks still in that age category most at risk. And finally, Jordan Sheff, we've got about half of the folks with developmental disabilities vaccinated. Many of them are in congregate housing, but about half have not been as yet. And there we are going to prioritize. We're going to get the mobile vans to these communities, outreach to those young people with developmental disabilities, and make them a real priority as we go into this last age group. And I think this is a way that we can keep you safe and make sure that we're taking the kids seriously and those most at risk. Next up, we're thinking a little down the road now over the course of the next 4-8 weeks. And these are young people. I talked about hospitalizations going up a little bit. Obviously, they're not going up in the category 45 and above. They are going up in the category of younger people, 16 to 45. And we do want to prioritize over the course of, end of May, April, high schools and colleges. College and university, we're going to be rolling out the J&J, the single-dose vaccine for colleges, hopefully in May, before those students go back home and they disperse, make sure they get vaccinated. I'll be working with our fellow governors to see if they do the same thing in return, just to make sure that universities dispersing is not one more way that we spread the virus in any way. And secondly, when it comes to high schools, only the Pfizer vaccine is available for kids 16 to 18. So we're going to prioritize that, bringing vans into our high schools, starting with the Alliance school districts. Many of those kids a little more likely to live in, multi-generational housing, and start that up over the course of the next few weeks and make sure those young people do get a priority going forward. And why is that? One of the things that was not 100% certain seems to be very certain now, that the vaccines are very effective at preventing infections. We know that it prevents you, once you're vaccinated, from suffering, hospitalizations or more dire consequences. It's worth remembering that when you get vaccinated, you're not only keeping yourself safe, you're keeping everybody you are in contact with safe. And many of the infections are happening amongst younger people, which is yet another reason that we're going to be focusing on that high school demo as well as the colleges going forward. And finally, as a lead-in to Vanessa and Beth, we were really privileged to have the Vice President of the United States, Kamala Harris, come. Miguel Cardona, who we know so well, was there as Master of Ceremonies. And Beth and myself and Vanessa, as well as our senators, had a chance to talk about kids and talk about what we're doing. And the Vice President, wanted to see what we could learn and take around the rest of the country. And, Vanessa started off talking about DCF and the foster kids, and I'm not going to steal her thunder, but to say what we can do to keep those kids safe and what we can do to keep them with their families. And then we'll hand over to Beth Bai, who is having the greatest expansion of child care and daycare in the history of this state, made possible by the rescue money that we'll be getting over the course of the next couple of months. I care deeply that we have fewer women in the workforce today than any time in a generation, having a hard time getting some of those folks back to work. In many cases, that's because of the high cost of child care. They can't get their kids into child care. That's going to change, and Beth will tell you how we're going to expand that reach. But with that, Vanessa, let me just introduce you, Vanessa Durantes, amazing commissioner, Department of Children and Families, dealing with thousands of kids who otherwise wouldn't have a home. Vanessa?
Thank you so much, Governor, and thank you for the opportunity to meet with Madam Vice President on Friday. I am still on cloud nine because she gets it. The administration's focus on eradicating child poverty, I think their target is lifting half of America's children out of poverty, I think is the right metric. For us here in Connecticut, we know that about 84% of the accepted reports that come into our care line have at least one allegation of neglect. And oftentimes the allegations of neglect are the ripple effects of poverty. We determine that sometimes there's not even an associated piece of child maltreatment with that. So we want to make sure that we can give kids the best start possible. And we know that some of the drivers of that have to do with food insecurity and housing. And what we're going to talk about today is childcare. And so the access to quality childcare has an impact on many more systems. We also recognize that of that 84% of the reports that typically come in, last year that percentage went up to about 88%. So we know that families are just struggling to survive and meet their basic needs. When we think about the impact to a system like mine, even though Connecticut is well below the national average of the number of children per 1,000 that come into care, we do know that this is also an issue that can address some of our equity and disproportionality. We recognize the fact that children, the little ones, 0 to 5, make up 58% of the children that I have in foster care right now. We also recognize that to address this issue from an equity standpoint, that Black children are 2 times more likely to come into foster care. Hispanic children, 1.5 times more likely. Addressing child poverty, addressing high quality childcare not only keeps children safe, but it elevates their parents. The best way to protect kids is to support their parents and to lift up communities. So, Governor, I'm really excited about this opportunity to help understand what the resources here to Connecticut mean for us. And we recognize that quality childcare is right up there as a way to keep children safe. So thank you so much for this opportunity from Friday and for today to talk about this issue.
Yeah, well said, Vanessa. And Vanessa is doing everything she can to allow these kids to stay with their family, broader family or a nuclear family. Beth Bai, how are we doing on child care?
Hi, Governor. Thank you. It's great to join you today. It was amazing to be with you with the Vice President and as part of your administration and with our legislative delegation from Washington. That was quite an experience. Vanessa and I were quite impressed with the whole event. Just to piggyback off of what Vanessa talked about, Commissioner Durantes, when you talk about child poverty, the highest levels of child poverty in Connecticut are among children 0 to 6 years old. And that's in part because of the strain and the cost of childcare, the strain that puts on a family. And Governor, your proposal for childcare is really groundbreaking that you announced last week. You have been focused on this issue since the American Rescue Plan was announced. You called me that day to say, what are we going to do? I want to do something transformative. And what you've suggested really will help families get out of poverty. The first part that I want to talk about is what we're doing for parents in workforce development, or maybe who are working but want to take the next step and take a class, a workforce development class, or get a degree from a community college. For more than 25 years in Connecticut, we have not helped with childcare for people in workforce development, closing a door to families who want to make their way up. That parent who's working a job paying $13 an hour, who knows that if they could take a class in manufacturing technologies or in healthcare, that they could really increase their salaries and help their families do better, and thus help their children. As Vanessa talked about, the strain that poverty puts on a family, we all pay for. So for 20 years, Connecticut has not paid for childcare for people in workforce training. And now with the funds, the governor has agreed that for 2 years, we're going to really try to help lift those families who need workforce development up into higher paying jobs. Secondly, childcare programs were hard hit in the pandemic, much like other businesses that rely on people enrolled to make their budget work. And 3/4 of childcare in Connecticut, they are small private businesses, mostly women-owned businesses. And they were devastated, operating at between 30 and 60% of capacity and still having a staff to pay. And the governor has set aside $120 million in grants to go help those programs so that when parents are going back to work, that as things speed up in our economy, there are childcare spaces there for those families. Otherwise, Connecticut was looking at losing 40,000 childcare spaces, according to some independent analyses. The other really transformative piece of the package that the governor announced is that for state-funded programs that receive child care subsidy, we are going to pay for high-quality care at a much higher rate than we pay for care that is licensed. It's all important that child care is licensed, but accreditation, we know, leads to more school readiness. We know it leads to better working conditions for the women who are working in child care and some men. And so that's going to make a really big difference. And finally, the governor announced a couple of weeks ago that Connecticut's going to pay the fees, the parent fees, for families that are on Care for Kids as well. So this is like a family of four that makes $60,000 a year or less would qualify for a child care subsidy, and they would have a parent share. But again, recognizing that that's the hardest hit part of our economy, that parent will not have a parent fee through December of 2020 into 2021. And that's going to make a really big difference for families. So this $210 million plus investment is, as the governor said, transformative for Connecticut, for the child care industry and for families, and at the core of it, for children. Thank you, Governor.
Thanks, Beth. At the core of it for children, and remember the $3,600 a year tax credit for those kids 1 to 5. That is going to lift 50% of these kids out of poverty, as Vanessa would point out. So in addition to Beth and Vanessa, of course, we got Josh and Paul, and any of your questions.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. Just going back to some of the medical conditions that are going to be accelerated for access, can you talk about, again, how many doses are being set aside for those people and exactly how they can sign up for a dose?
Why don't you take that, Josh? You talk to the CMOs.
Sure. So as Commissioner Gifford and I have been interacting with the CMOs, as the governor has pointed out many times before, the vast majority of people with those conditions are above the age of 45 and therefore have already been vaccinated or offered vaccine. What we're looking at here between the ages of 16 and 44 is about 10,000 people statewide. So it's not a huge number, and many of our hospitals are very active vaccinators and have significant allocations already. So we don't anticipate them needing additional allocation. but we are providing additional allocation to Connecticut Children's over the next couple of weeks. They have not been active vaccinators, but they will be for the next couple of weeks, very much so. And what this will look like will vary a little bit depending on the hospital. I think what you'll see is some hospitals doing dedicated clinics, some doing dedicated outreach with reserved appointment slots for people with these conditions. And in some cases, people will just simply get vaccinated during their normal doctor's appointment at the hospital that may already be scheduled over the next couple of weeks. So it'll be a little bit of a mixed approach depending on the facility. And I think they'll all be communicating their respective plans in the coming days.
And how were these conditions chosen, and why weren't other ones the CDC has flagged as high risk potentially for COVID?
These were the conditions that the chief medical officers at the hospitals felt were most worthy of prioritization in this next week or two. The conditions that they wanted to make sure that those patients had easy access over the next week or so. But recognize, if you are, on one of those other long CDC lists not listed here, we are confident that there's going to be enough vaccine, even for the younger folks between 16 and 44 over the next three weeks, maybe 4 at the most. So everybody is going to have access in the very near future.
And finally, why was the state able to prioritize these high-risk groups now and not back in February?
Well, there's one big difference now. Everybody's eligible. So you don't have to worry about doctor's notes, complex eligibility screens, and a lot of the issues that the providers were very worried about. We're going to slow them down. But also, as I mentioned, recognition of the fact that the vast majority of people with these conditions are older and were captured by the governor's strategy to vaccinate older people first, which, as he pointed out earlier, now has us in the very fortunate position with 80% of our seniors 65 and above having received their first vaccine. And as you see an uptick in cases in the Northeast, that's a great place to be and a better place to be than many of the other states in the area. So, that was clearly the right approach.
Okay, thank you.
Channel 3 Eyewitness News.
Yes, Governor, I'd like to go back to the CDC director warning of a fourth wave. I would assume that, if a fourth wave were to come, this would look different than any of the prior waves because the people who are most vulnerable have been vaccinated or have had the opportunity to be vaccinated. So if we do see a fourth wave, how will Connecticut manage it this time around? Will restrictions be as severe as we've seen in the past?
I think we're going to manage it because those who are most vulnerable have been vaccinated. And as you can see, the number of vaccinations we're getting is accelerating quite a bit starting this week. I think we're going to manage it by beginning to focus as soon as we can on high school and college age to make sure that we don't forget about that age group, since even though they don't suffer particularly dire consequences, they can be infecting. I think we know from 1918, 1919 that while everything mitigated, there were flare-ups in different parts of the country. Just the way you look around the world now, there are flare-ups in different countries. But I think Connecticut, and I think most of the United States, is going to manage pretty well just because we're accelerating our vaccination in a big way.
All right, and I just wanted to get your opinion on President Biden. He's asking for states to reinstate the mask mandate because people have been letting their guard down. But here in Connecticut, our mandate has not been lifted. So in your opinion, how are we letting our guards down?
I think there are an awful lot of kids who probably went down to Miami Beach and enjoyed spring break, and I didn't see many people wearing a mask there, and maybe those guys are going to be coming back to Connecticut and other homes around the country and potentially bringing what could be a mini risk. I hope not. I hope these are young people. I hope they've used their discretion. I think, generally speaking, Connecticut has not let its guard down. And I'm really hopeful that as it gets warmer and we're outside, we are able to, keep our distance outside where it's so much safer than being congested inside.
Thank you.
News 8.
Good afternoon. Governor, Matt sort of asked my question, but just kind of piggybacking off of that, if you listened to Rochelle Walensky earlier, I mean, she was almost emotional when talking about her concerns. So will that change now? Because New York and New Jersey are now 1 and 2, in new cases per capita. That's on our doorstep. Other than the rate of vaccinating people, is there anything else you'd consider changing now with respect to that?
Look, I do notice that New York and New Jersey are relatively restrictive, by the way, in terms of, occupancy and the such. There's a certain seasonality, and right now in the Northeast, I'd say all of our neighbors have a slight uptick. Connecticut has been relatively stable. But look, here's the deal. We have the ability to change course if we had to. We obviously monitor, usage in our hospitals very carefully. If it's been going up, it's been going up on a gradual basis. So I know we'd have time to change course if we had to. I don't see any need to do that. I think the vaccinations are going to stay ahead of the risk.
And for the guests, when you talk about the money that has been allocated and children in poverty situations, what specifically can you do now moving forward to help the parents? As I think the governor and both of the guests alluded to, helping the parents will certainly in turn help the children.
Beth, you want to start with that?
Sure. It's a great question, and then I'll turn it to Vanessa. But it really helps parents if they can access next steps. If a parent is stuck in a job where they can't make a living wage and they can't take the next step with a training program or schooling, that's discouraging, and that certainly impacts the children. Also, for families of four making less than $60,000 a year, that paying their parent copay for 6 months can really help them financially. And we believe that these changes on top of the child tax credit that Rosa DeLauro worked so hard on can really make a meaningful difference for children. Vanessa, did you have anything to add?
What I would add, too, is just the focus on the healthcare, the child care essential workers. When you think about people who are delivering a lot of the services to the families most in need, they also, need a boost. And this particular allocation will help them as well, Beth. And I think that's important for us in terms of a context. Both Commissioner Bai, myself, and Commissioner Delphin-Rittman from Mental Health and Addiction Services co-chair the Governor's Council on Women and Girls and the Health and Safety Subcommittee. And we know that a lot of the child care providers are women-owned businesses. We know that a lot of the staff are women and people of color. And so, allocations like this really do boost up not only the child care industry, but the families that are addressing just basic needs that may have gone challenged during the pandemic.
Thank you, ladies.
Fox 61.
Hi, Governor. I know you just, mentioned spring break in Miami, but state police reported they had to break up a party off campus near UConn Saturday night, about 100 people. They report no social distancing, no mask wearing. There was also a similar incident that happened near UConn earlier this month as well. Can you comment on that situation? But also in general, we're approaching, like you said, warmer weather. And once again, we're just seeing a situation in which young college-age individuals are letting their guard down.
Yeah, it's we got a little spring fever, and because it's been a very, very long year, and I appreciate that, and especially for the young people and what that means to them. And I can't say firmly enough that we can make an enormous difference for the rest of the summer and the rest of the year and going forward if we keep our guard up a little bit longer. And that's especially true of the young people who are likely to be ready to party and ready to let it rip a little bit. I just urge you, every few weeks will make an enormous difference for your dorm, your community, and our state.
Thank you. And then, Josh, this question might be for you. Do we have any reasoning behind why hospitalizations have ticked up recently? And then we've also been seeing cases in New Haven County are increasing more than Hartford and Fairfield counties. Any comment on that?
Sure. I think it's exactly related to what the governor just described. I mean, fortunately, the average age of people who have been hospitalized for COVID has come down dramatically. We're seeing far less people 65 and above hospitalized as a function of the high vaccination rates among our older population, which is great news. But people need to remember, you can still get very severe COVID even in your 20s and 30s and 40s. You're not invincible. And back to the governor's answer he just gave about how important it is for people to keep their guard up a little bit longer. That is part of the challenge we have right now. With regards to New Haven County, as we I think discussed last week, the Valley, the Valley area is a bit of a hotspot right now, in and around Derby and Sonia in that area, and a lot of those individuals end up at Yale New Haven or at Griffin, and so we are seeing a bit of a spike there, and it's an important area that we make sure everyone is taking proper precautions to get that back down.
News 12 Connecticut.
Good afternoon. This is Suzanne Goldklang. Getting back to the list of conditions, is that a suggestion or something that will have a paper trail, and will medical providers have the chance to add perhaps patients who don't fall in that category but they're concerned about to that prioritization system?
Josh?
Yeah, I think it's important to remember that as of Thursday, everybody is eligible for COVID vaccine. So people don't need to worry. Like, if you have a medical condition that you didn't see on that list, you're going to be able to go online or call the 211 line, or one of the other providers, one of the pharmacies, and make an appointment for yourself starting on Thursday. Now, there will be a lot of people queuing up on Thursday. So as always, when we start a new phase, people will need some patience. But you're going to have an opportunity. Everyone in that group is going to have an opportunity to get an appointment in the next 2 to 3 weeks. So I wouldn't, overread or worry too much if your condition is not on that list. That's just a little extra, invitation from hospitals for certain severely ill people to make it a little bit easier on them to get in over the next week or so.
And can you talk a little bit about how that invitation will happen? Will there be like an open pop-up clinic, or will they have phone calls going out, or how might that work in some places?
Yeah, so as I mentioned earlier, different hospitals are going to handle this differently. I think you'll see some will do outreach directly to the patients in their system, give them, some reserved appointment slots at their mass vaccination sites. Some others may do a dedicated clinic, and some others may just look to vaccinate patients as they come through for their normal appointments over the next week or two.
But if, say, a medical provider wants to add asthma to that list or something like that, they're free to. There's not a regulatory thing requiring documentation of that condition list.
That's true. But again, everybody's eligible as of Thursday.
And if I can ask one other question, we are going into a holiday weekend. We do see these numbers rising in New York and New Jersey. Are you wanting to encourage people to think twice before they do go to Easter in these areas that now seem to be having a bit of resurgence?
If you can stay close to home, it's a good time to do it. I love Florida, but not this season.
Thank you, sir.
WTIC 1080 News.
Good afternoon. 40% of the state's current cases are of the more transmissible UK variety. That's the strain that has much of Europe in trouble. What's the research telling you about the impact of that strain?
I'll start that it's highly infectious and that the vaccine works. It's interesting that the UK variant in the United Kingdom is relatively under control due to the high level of vaccinations there.
Does it concern you that the Philippines shut down, and you mentioned Brazil on another strain is concerned about shutting down? Dr. Gifford said over the weekend we're not anywhere close to. Sorry, I'm working outdoors here. Dr. Gifford said over the weekend we're not anywhere close to talking about a lockdown. Is a lockdown or more mitigation measures in your toolbox in the case it backslides?
Look, everything's in the toolbox, but right now I think given the good pace we have of vaccinations, we're not going to have to do that. But again, I look at our neighbors all the time, and you pay attention to these things. Thank God our hospitalizations are not going up very fast.
The Associated Press.
Thank you. Good afternoon, everyone. Should families of teens, should they start to sign up their kids on Thursday, or do you want them to wait until these special clinics are held?
I think we should wait a little bit, but Josh, do you want to take that?
Yeah, that's right. I mean, I think if you're, the parent of a older teenager above 16, or, if you're in your 20s, you're perfectly healthy. Yeah, please give it a week. You're going to get your turn very soon, but let's let, people in their 40s or people with some of these other conditions get appointments first. I think that's good advice.
And Josh, that number 10,000, the people with the high-risk conditions, does that include folks with developmental disabilities too, or is that a separate group?
No, that would be separate. So we think that there's about 9,000 individuals with intellectual developmental disabilities who have not yet already been vaccinated because they may live in a congregate setting. So we are we'll have about 20 dedicated clinics for that community starting this Friday with the first 2. And invitations will be going out from DDS to all of those families. They will need to sign up earlier. In many cases, we need to collect consents. And so that is already in motion. And those clinics will take place over the next 2 weeks.
Oh, great. And then I had a question for the Commissioner Durantis. Where do things stand with DCF's in-person visits with families? And is the agency examining at all whether there may have been some abuse cases that went unnoticed during the height of the pandemic?
So thank you for that question. The department hasn't closed. We continued to send people to do home visits throughout the pandemic through a triage process. The safety and risk factors were at the top of the list there, and that in each of our 14 area offices, as well as our care line, and use this triage process to determine when an in-person response was safe for the participants. And just like you indicated, because we really focus on the issue of child maltreatment, the focus on high safety or high risk situations rose to the top of that. There was a national concern about the lower number of reports to child abuse care lines, but we recognize that families were really trying to just make it over the last year, and that we have still had in-person responses throughout the pandemic.
Thank you very much.
The Waterbury Republican American.
Thanks very much, Max. Governor, could you maybe explain how you will know when vaccinations aren't keeping ahead of the risks? I know you said you're confident that will happen, but what measures will tell you that it isn't?
Yeah, Paul, 2 things, I think. One, I'd worry if I saw hospitalizations going up quite a bit. That would mean even though we're vaccinating an awful lot of people, there are still a lot more people who are getting infected and suffering dire effects or ill effects. I think that would be the number one criterion I'd have. And as I saw you today when we had the mobile van, I've got to, we're going to have to work extra hard starting next month when we have more vaccines than demand to really reach out to those communities that, demand an outreached hand, a mobile van. Make sure you can get vaccinated, no questions asked, no cost, and make sure we get everybody vaccinated. We got to get to that herd immunity, and that's going to include young people as well.
Okay. And do the 17 communities encompass all 50 of the targeted zip codes or not?
We're certainly focusing on those targeted zip codes. We've made really good progress in the last week on that. We have a way to go, Paul.
Okay. But I'm just wondering, the list of the 17 towns and cities that was issued today, does that encompass all 50 of those zip codes, or are there some that aren't on the list?
You got that, Josh?
Yes, they're all covered on there. And then don't forget, starting next week, we're also going to have the other mobile units, the 35 smaller mobile units that the governor announced last week as well, starting to crisscross the state and fill in additional areas. So there'll be a significant additional complement to that FEMA unit, which, by the way, builds as well on a lot of effort that many of our providers have already been making with mobile clinics for the past several months. So we're going to have a lot more coverage across all those zip codes and the rest of the state.
And can you give us an idea, if even it's just the town where the first two clinics for the developmentally disabled will be held?
I think that the team at DDS will probably publish that in the next day or so. I don't think that's ready to go out just yet.
Okay. And is there going to be any kind of stratification of the pre-existing conditions by the healthcare providers? Will, certain conditions be given a higher priority in vaccination order than others that are being included?
No. Look, we've gotten to the point where we are right now, where we're second in the nation and the highest percentage of our population vaccinated. We've got 2/3 of every person in this state who's 45 and above, representing where 98% of the deaths have come from. 2/3 of those people now are vaccinated. We've gotten there by moving fast. So we're not going to overcomplicate things when we're at the 2-yard line here. Everybody who wants a vaccine is going to have access to one in the next several weeks. And we're working with our providers to make sure we continue to get vaccine out as quickly as we can.
Okay, just I guess one last question. I guess it might be for the governor or who else might know. Is there any kind of time frame associated with the second application for a FEMA van? I don't recall hearing any kind of timetable mentioned this morning in Bridgeport, but I could be wrong.
We're definitely going to apply. I think they gave us the first in the nation opportunity because we put in place a plan to get to those 17 towns. Those where people were least likely to get vaccinated unless we brought the vaccine to them. And we're going to do our best. I think you heard Johanna and Dick say this, to demonstrate we could use a second van when that's available.
But we have no idea when that might be available, though.
I don't.
Okay, thanks very much.
The Day of New London.
Hi, Governor. You mentioned that the state will ramp up outreach efforts to college students beginning in May. Will all students in the state be eligible for vaccinations or just students actually from Connecticut? Will out-of-state students have to be vaccinated in their home states?
I think, Josh, correct me, but I think everybody at our colleges will be eligible to be vaccinated.
That's right. The requirement throughout has been live or work in Connecticut. And so college students who are here going to school live here, obviously, so they're eligible.
Thank you.
I might add, if I could, that we're going to make similar recommendations to our fellow governors because we're going to have a lot of young people coming back from their states, usually more infected states.
Thank you.
CT News Junkie.
Thanks, Max. Josh, on the DDS clinics, you said you expect about 20 of them and maybe 9,000 individuals. How long a time frame are we looking at for that to take place over?
The first one starts on Friday, and they'll all be done within 2 weeks.
Oh, okay. Thank you. I don't know who best to address this, but the Senate Republican leader just sent out a press release on the Grossman contract, the $24 million contract, supposedly to try to convince folks to take the vaccine. He's saying that at this point, a year later, maybe it should have gone out to bid. Can someone just talk about the necessity for it and why we're still not bidding on these things?
Well, I'll start, and then I'll hand it over to Paul. But look, we know that there's a population where they just aren't the worried well, and they sit around refreshing on their internet access at 12:01 on Thursday morning coming up. There's a significant population that we really have to reach out to. So I think, Deirdre and Josh and the team, they found a group that really can make those phone calls, knock on those doors, and do everything we can to get the vaccine to people who are otherwise maybe wouldn't otherwise be vaccinated on a timely basis. Anybody want to add to that?
I'll add to it, Governor. This was an existing contract working with Access Health. Their CEO, James Michel, and his team reached out to DSS, reached out to Commissioner Gifford and said, how can we help? We utilize an existing contract with the entity you named to get people signed up for health insurance. So we're utilizing the same methods that the Access Health team has utilized with the same contract and the same team to make sure that we get as many people in the state of Connecticut vaccinated. If that's a problem, then I don't know what's good in the world. And so we're going to work off of this existing contract that has been thoroughly done. We put out a full, transparent press release on the matter, and we look forward to answer any questions that anybody might have. But the one metric that we're going to be happy to provide is how many people that we got access to vaccinations through our vans, through knocking on the door, through going to them door by door and meeting them where they are, so we can get them vaccinated and get this state moving as the governor has always said that he will.
Okay, thank you.
Connecticut Public Media.
Good afternoon. What is the state seeing right now in terms of testing? Is demand dropping? And do you know who's getting tested? Are we seeing more younger people, more in congregate settings like dorms, et cetera?
Well, testing did sag a little bit over the last couple of weeks, but it's certainly picked back up in the last week. We're up to 243,000 tests performed over the last 7 days. So often, as you see a little uptick in cases and positivity, you'll see more people getting tested, more people who've been in contact. And look, we still have an incredibly robust testing infrastructure around the state. We'd encourage everyone who thinks they may be at risk to get tested. Anyone who certainly has symptoms to get tested and to quarantine and isolate and help nip this uptick in the bud.
And do you know exactly the majority of the population getting tested? Is it mostly, we're seeing a lot of people who are younger getting sick. Is it mostly younger kids, people in college? Do you have any breakdown of who's been getting tested the most lately?
It has skewed a little younger. Again, we've seen a continued downward trend in cases among older people 65 and above, largely because they've been vaccinated. As the governor pointed out, the CDC is now out with data that shows how effective the vaccines are at preventing infection, in addition to preventing severe illness. So that's incredibly great news. So there's been less need there. And yes, as we've seen more cases, as we showed last week, among the younger people, now there is more testing going on there.
And last question, as more people get vaccinated, what's the state's plan for testing going forward?
Well, I think it's a bit of an open question right now. I think we're going to need testing for some time to come, until COVID really recedes into the rearview mirror completely. We still have large portions of the population that are not yet vaccinated. And even once we get, another month or two into this, we may still have pockets around the state that have lower vaccination rates. And we're going to need testing to ensure, quick turnaround for them. Hopefully we can get out of the testing business before too long. I think there's a lot of us that would be thrilled to do that. But we're going to be, following guidance from the CDC and the best science available and the recommendations from the public health teams going.
Thank you.
Hearst, Connecticut Media.
Hello, question for Commissioner Bai. How will these child care programs stay active and viable after 2 years when the funds run out?
Thank you for that question, Nick. The idea here is that this is a single time and that families have been hesitant to bring their children back, but they are coming back and we are seeing that already. It's just going to take a while. So that's the point. That's how the federal stimulus funds were designed, that these grants to programs, all programs, public, private, would help them stay open while the economy recovered, and then they'll be full and then they won't need the support anymore.
Thanks. And a question for the governor. Given that access is opening up pretty broadly for vaccines on April 1st, are there any plans or discussions around creating a vaccine passport program similar to what they're rolling out in New York?
Yeah, that's a very good question, Nick. I can tell you that the COVID task force, the White House, is going to be doing a preliminary presentation on that for us tomorrow. I think it's a little premature, only in that not everybody has the vaccine available to them yet. But I'd like to think within a month or two, when broadly available, I think you will see some type of a vaccine passport or validation, just like you see New York is considering, probably led by the private sector, just like, New York, if you want to go to Madison Square Garden, or you want to watch the Nets play or other type venues, they're saying we'd like to see some authentication to show you've either been tested or vaccinated. Obviously, travel, I think, will be another area where you see the, quote, passport used widely.
Thank you.
The Connecticut Mirror.
Hey everyone. For folks that have underlying medical conditions, but whose primary care physician is a small or independent provider, how would those folks go about getting one of those priority appointments?
So our understanding is that there's likely to be very few, if any, that don't have some sort of, in those categories, who don't have a relationship with one of the acute care hospitals. But if there is someone in that category you describe, they should certainly, through their doctor, they can reach out to the hospital that they're affiliated with to make sure that they're included.
And when you guys had consulted with folks to come up with your list of underlying conditions, were independent providers consulted, or the state medical society, or anybody outside of those medical officials you described?
It was led by the chief medical officers from the hospitals. I don't know if they included those folks or not, or who else they included, but I know they did have a large group working on that.
And President Biden said today that by April 19th, 90% of Americans will be eligible for the vaccine, and that 90% of Americans would also have a vaccine site within 5 miles of their home. Obviously, by that date in Connecticut, everyone will be eligible, but how optimistic are you about the vaccine site estimate?
Well, I can start. That's one of the reasons we have the mobile vans. That's one of the reasons why we have a dozen of mobile units, so that if you can't get to one of our fixed sites, we're taking it to you. That'll be on a prearranged schedule. You'll probably get a telephone call saying we're going to be in your neighborhood. And at some point in the next few weeks, maybe you won't even need a reservation. Just go get vaccinated.
That's exactly right, Governor. And in addition, I think one of the things the president was alluding to was an increase in the federal support for the federal pharmacy program. And so, we do expect later this week a number of additional pharmacies around the state. We've already got pharmacies administering vaccine, obviously CVS and Walgreens and Walmart, Stop and Shop. Dozens of independent pharmacies are already administering vaccine. And later this week, there's another 4 large chains that will be coming online as well. And I think that's where a lot of that 5-mile coverage will come from, is those pharmacies at supermarkets and independent pharmacies all around the state.
So you do expect to hit that goal?
Yeah.
Okay. Thank you.
The Hartford Current.
Hi, Governor. It's Eliza Fawcett from The Current. Hospitalizations have risen 25% in the past week, from about 400 last Monday to 500 today. Wouldn't you say that's more than just creeping up?
Well, I think it's going up from a very, very low base. Remember, we were at probably 2,000 a year ago, or almost a year ago, when we were really worried about reaching capacity. So, yeah, I'm not dismissing it. It's a younger age group. They are getting infected. Maybe they are a little more casual than they should be, and we are watching this. But I think in terms of capacity at our hospitals, I still feel pretty confident, and so do our hospital administrators.
Do you still feel that reopening was the right decision, given that metrics are, rising and plateauing, not falling?
I do. Look, when you say reopening, obviously we're maintaining the mask, we're maintaining the social distancing, we're maintaining the things that I think work. We're going to do that a little bit longer until we really get this virus under control. But I think allowing people to go into the stores and restaurants carefully makes good sense.
And in terms of vaccinating college students, the vast majority of UConn students will be sent home for remote learning in early May and won't be on campus in May. In early April, and won't be on campus in May. Will it be possible to get them vaccinated before they leave, or can they return to campus for the vaccination clinic? How will that work?
Good question. Josh?
Yeah. UConn is really the only college university in the state that's not coming back after spring break. So for those students, they can access vaccine through the normal channels, signing up at any of the vaccination sites around the state.
And just one last question in terms of the accelerated access. What would you say to folks with conditions other than those 5 who may have initially hoped that they would get that expanded access?
They'll still have access to vaccine in the next 2 to 3 weeks. So their wait is quickly coming to an end.
Okay, thank you.
Yep, April 1st is Thursday, and everybody will have it available over a period of time. Let me just say, as our very own Miguel Cardona likes to say, how are the kids doing? And thanks to Beth Bai and Vanessa Durantes, our kids are doing as well as they can in this really tough environment. And speaking of amazing women, let's get off COVID for a second. How about the UConn women? I mean, they had a big win on Saturday, and I got to tell you, tonight they're taking on Baylor. Baylor was the world champion back 2 years ago, the last time we had an NCAA champion. Many people think this could be the championship game. It's at 7 o'clock tonight. Cheer on the UConn women. They're going to do us proud. Thanks, everybody.